Welcome to this resource on rheumatic heart disease. We'll cover helpful information you may see on exams and do practice questions at the end. But first, welcome to Artemis Interactive Media. Artemis is your guide to learning resources and content overview for continuing education. You may note a heart at the top of this resource to indicate that this topic may be covered in pediatric courses with the color indicating the specific body system. This quick timeout is a short study break and will cover rheumatic heart disease. If we need any help, Artemis will be here to guide us. Rheumatic heart disease often develops after untreated streptococcal throat infections, also known as strep throat. Rheumatic heart disease can occur after rheumatic fever. Inflammation can damage heart tissue, and the heart valves are commonly affected. The mitral valve is most commonly affected in rheumatic heart disease. Inflammation and scarring may cause the valves to narrow or function improperly. This reduces blood flow efficiency. Severe valve damage may eventually require surgical repair or replacement. Common symptoms include heart murmurs, chest pain, shortness of breath, and some patients may also experience fatigue, weakness, or decreased exercise tolerance due to impaired heart function. Treatment and nursing care may include antibiotics to prevent recurrent streptococcal infections, anti-inflammatory medications to reduce inflammation. Nurses should monitor cardiac status carefully and educate patients about the importance of follow-up care and medication adherence. Let's cover some key takeaways. Rheumatic heart disease is a preventable complication of rheumatic fever and untreated strep throat. Early recognition and treatment are essential to reducing long-term heart damage, so ask about a recent sore throat. Ongoing monitoring and follow-up care help improve patient outcomes. Before we test our knowledge, rheumatic heart disease can be a complicated topic to understand. Rheumatic fever is a systemic disorder, however, the most serious complication is cardiac involvement. The following questions will test your knowledge on the material we covered in this resource, so please answer the following 5 questions to gauge your mastery of this material. But don't worry, if we need help, Artemis will be here to guide us. Question 1. A nurse is teaching a group of parents about rheumatic heart disease. Which statement best describes this condition? A congenital defect present at birth. B, heart damage that can occur after rheumatic fever. C, viral infection affecting the lungs. D, a disorder caused by high cholesterol. And I'm going to say B. Rheumatic heart disease develops when rheumatic fever causes inflammation and damage to the heart valves. Question 2. Rheumatic heart disease most commonly develops after which untreated condition? A, ear infection, B, influenza, C, streptococcal throat infection, or D, pneumonia. I'm going to say C, streptococcal throat infection. Untreated strep throat can lead to rheumatic fever and eventually rheumatic heart disease. Question 3. Which heart valve is most commonly affected in rheumatic heart disease? A, pulmonary valve, B, tricuspid valve, C, mitral valve, or D, aortic arch. I'm going to say C, mitral valve. The mitral valve is the valve most commonly damaged by rheumatic fever. Question 4. Which medication type is commonly used to prevent recurrent streptococcal infections in clients with rheumatic heart disease? A, antifungals, B, diuretics only, C, antivirals, or D, antibiotics. I'm going to say D, antibiotics. Long-term antibiotics may be prescribed to prevent recurrent infections. Question 5. A parent asks why follow-up care is important after rheumatic fever. What is the nurse's best response? A, follow-up care helps monitor for heart valve damage. B, rheumatic fever never affects the heart. C, children usually outgrow the condition without treatment. Or D, monitoring is only needed during childhood. I'm going to say A. Ongoing monitoring is important because rheumatic fever can lead to long-term heart valve complications. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Rheumatic heart disease involves more than this QT covers. For more information on this disorder, please contact your instructor and refer to your textbook. If you would like to review the references used in this resource, you can find them here.